This is Jazz. She is a 12-year-old American quarter horse mare that has been with us since 2021. Since she arrived, we have been battling with hoof issues. She came with very overgrown feet, very long toes, and signs of previous laminitic episodes. We have been working on rehabbing her feet and had another setback when she later became infected with anaplasmosis. With the help of a huge and dedicated team, such as Dr. Trevor Lawson from Fundy Vets, Dr. Kate Armstrong of Armstrong Osteopathy, Dr. Kristen Pike, and Rosemary Swinenberg as her farrier, we have been able to make some significant progress with Jazz's recovery and comfort. Jazz has been sporting some fancy glue-on composite shoes for several months now, and they have greatly helped with her comfort level. Glue-on composite shoes have advantages for horses in many ways, especially when it comes to hoof rehabilitation. With the glue-on and composite materials, the hoof care provider, that's Rose, has the infinite ability to build a prosthetic hoof to help the horse while they heal. These materials have a similar durometer, so that's the tensile strength and hardness, to the hoof wall as well. We were presented with a unique learning opportunity for some local farriers to do a Venogram on Jazz's feet, which would give us further insight into her condition and allow us to help her further. Laminitis is the most serious disease of the equine foot and the second biggest killer of horses behind colic. It is estimated that 1 in 10 horses will be diagnosed with laminitis at some point in their lifetime, and the majority of these horses will develop severe or chronic laminitis. By definition, laminitis describes inflammation of the lamina of the hoof. The lamina are finger-like projections arising from the coffin bone and internal hoof capsule that link together, effectively suspending the coffin bone within the hoof capsule. Inflammation of this structures damages the structural integrity of the hoof, leading to instability and debilitating pain. Equine laminitis remains an active area of research, as there is a lot that the scientific and veterinary communities don't understand about the disease. At present, research has identified 3 unique mechanisms of laminitis, the first being endocrinal laminitis, which is associated with metabolic disorders that result in hyperinsulinemia, endotoxic or sepsis-induced laminitis, which is associated with inflammatory events that result in severe systematic inflammation, and the third is mechanical overload laminitis, in which excessive concussion or weight-bearing impairs blood flow to the hoof. Knowing what caused laminitis in your horse and how much weakening of the laminar structures in the hooves has occurred is important when implementing a recovery plan for your horse. We don't know what the original trigger was for Jazz. It may have been pregnancy-induced insulin resistance and laminitis, as she was pregnant and with a foal on her side when we bought her. Her second round of laminitis was brought on by the anaplasmosis infection, which at the time we didn't know she had. It wasn't until we were doing more blood work to screen for possible metabolic issues, which she doesn't have, is that when we found the infection with the anaplasmosis. Anaplasmosis in horses is a tick-borne disease caused by a bacterium. Anaplasmosis is a vector-borne disease, primarily transmitted by these infected ticks. The main tick species responsible for transmitting this disease is the ixodes, or deer tick, which we have many in our area. Horses affected by anaplasmosis experience symptoms that can include fever, depression, swelling of the limbs, uncoordinated gait, and yellowing of the eyes and gums. So in Jazz's case, she had a very stocked up leg. At the time, we did not know that that was the cause, but we did treat her with antibiotics, and she did improve. Most horses have a favorable prognosis without the need of treatment. However, in some severe cases, the condition is highly responsive to antibiotic therapy and supportive care. As part of Jazz's care going forward, we have these Venograms, which are a radio-based contrast study using radiopaque dye, in which you can evaluate the blood flow and circulatory status of the hoof. It's probably utilized more with laminitic horses than any other pathology, but there are other situations where it can be proved to be useful. The basic technique involves placing a tourniquet just above the hoof, inserting a small IV catheter into one of the major veins of the foot, injecting this contrast dye, and taking radiographs as to determine where there is and isn't circulation within the foot. We are usually concerned with the circulation in the front half of the foot and the dorsal wall. With this type of information, we can monitor prognosis and either fine-tune our treatment or make drastic changes as needed or as indicated. So Dr. Kristen Pike had given Jazz some sleepy juice, and then she went to blocking the hooves so that she can't feel anything from the fetlock down. Next up was putting the tourniquet on the leg. This helps the blood vessel pop, which is going to make it easier for her to place the catheter in which she needs to inject the contrast dye with. You can see she's up on some blocks as well. And we clipped and cleaned the area to make sure it was good and sanitary for putting in the injection. Once the injection is put in of the contrast material, it is a very quick process. You need to take several x-rays in a very short period of time, so it's good to have a whole team of people there to help manage the x-raying process. So Dr. Pike's just putting that contrast material in right now. You want to do a slow injection because you don't want to blow the vein. If we blow the vein, then you have to wait for it to reabsorb and try to start over and choose a different vein to put it in. Once the contrast material is in, we're going to kind of pinch off the line and look at taping it up and out of the way. And then it's time to take some photos really quick. So we take some photos from either side of the foot, the front and the back, and then a non-weight beared photo where the hoof is held up. So again, it's good to have some people on hand to help with this procedure. Once it's done, we take the tourniquet off, which will increase the blood flow back to that area, and then we move on to the next foot. This is just getting the foot ready. You want to do both sides. Jazz's right leg is her worst one. That foot overall is in the worst shape. And here's the tourniquet going on. Got her all cleaned up, washing some of the hair away there. And clipping a little bit more so we have better access to the veins for the contrast material. Again, making sure it's nice and clean. Doing a quick alcohol scrub here, again making sure that it's as sanitary as possible. Now she's all clipped and cleaned and ready for the catheter placement and injection of the contrast material. And then it's time to take those x-rays as quick as possible before the contrast material disperses. So again, take some quick views, have some markers to show where the center of the hoof is. Non-weight bearing photo. Another one from above. And this just gives a good overall picture of the entire hoof to make sure that everything is covered and that we can easily see if there is any areas that are damaged by lack of blood flow. And when she's all done, we switch back over to the left foot because we did have a little bit of an issue getting good photos, so we had to do it again. Luckily, Jazz was enjoying the sleepy juice, so she was quite patient for the whole process. Your horses need to be very still for this process. That's why they need to have some sleepy juice sedation on board, as well as blocking the fetlocks, especially if they are painful. We want to make sure that they're not uncomfortable during the process. Once the photos were all taken, Rose did a quick trim on Jazz's feet. The x-rays showed us that she can take off a lot more toe. She's got some pretty good sole depth going on. When we first started this process, she was basically walking on the ground with her coffin bone. There wasn't a whole lot of space between her coffin bone and the ground, but we do have some good depth there now. She still has quite a bit of a rotation, especially in this right front, but Rosemary now is armed with some tools that can help her help Jazz and get her more comfortable and happy, which is our goal.
So we did a venogram on Jazz here, who has chronic laminitis. So a venogram involves injecting dye that shows up on an x-ray into the little digital veins in her foot. So you can see my little needle there. And that distends all of the little blood vessels in their foot, so we can see the blood perfusion to this foot. Mostly we are concerned with the dorsal artery that runs down the front part of this coffin bone. So a normal foot should have this like nice, clear, beautiful straight line. But you can see on her it's a bit hazy. She's got kind of a shadow of the contrast here, where she has some damage to the vessels and where the contrast is kind of leaked out a bit. So we do know that she does have some chronic damage to her foot there, but she still has a good amount of blood flow that gets all around the bottom of her coffin bone. The back of her foot looks great, really, so I'm not super concerned with that. We do kind of a series of views. So this is a shot from the front to the back called a dorsopalmar view, and we were looking at just the vessels in a different plane. This is the lateral side here of the right front foot, and you can see she's got really good perfusion on the lateral side, but as we come over here to the medial side, we kind of lose that. So she does have more damage to her foot on the medial side, but you can kind of just see a haze of the contrast, so I'm not too fussed about it. We do an unweighted view too to see how weight bearing actually changes the perfusion. So often they look better once they're not standing on the foot. So she does have more blood flow around the bottom of this foot on the unweighted view. And we also do an unweighted DP, so that's the outside. And you can see how the medial side has actually recovered here. It looks a lot better unweighted, and kind of the longer the contrast is in there, the blood flow kind of recuperates and picks up. And then we do a final view of the foot back on the ground. So again, she's got kind of the shadow here, but still a good amount of perfusion going on. And this one doesn't really matter. This is my tourniquet shot to make sure that my contrast didn't leak above the fetlock, so that we know it's a good venogram.
Cool. Awesome.
Those fronts, like the left front is definitely better looking. It's got a more clear cut artery here, and she doesn't have this like little shadow going on, so she does look a lot better on the left front. And then her DP was still kind of similar. This is the outside, so she is still lacking a bit of perfusion medially, but not as dramatic as the right front on her. Unweighted lateral looks really, really good. You can see a little bit more of this haze. It's probably hard to see on the camera, but you can see it a little bit more on the unweighted. But unweighted DP looks really quite good. She's pretty symmetrical on both sides. This is the inside. So I'm really quite happy with that. And then my late lateral looks really good too. So she looks stable. I'm not super concerned about her. She's got a really good sole depth. So I definitely think she's on the right track for sure.
Good news.
Yeah, these are really cool.
So here are some pictures of the radiographs. So we had the before the venogram, after the venogram, comparison side by side, left front foot, before venogram, after the venogram, and then a side by side for the right front foot. And then we have before and after of the left front, as well as a before and after of the right front. So in summary for Jazz, the prognosis looks pretty good for her. We will continue to take routine x-rays to see how her rotation is doing, as well as her sole depth. Rosemary is armed with some new observations and tools so that she can further help Jazz and get her more comfortable. We will keep her in her glue-on composites as long as needed to get her feeling in tip-top shape. If you have any questions, I will do my best to answer them, so feel free to ask, and thanks for tuning in.